Less than 10% of the population has received the first dose of a COVID-19 vaccine, despite the major vaccination drives being held by the Ministry of Health. The revelation came from Minister of Health and Wellness, Dr. Christopher Tufton, as he addressed the ministry's COVID-19 virtual conversation this week. The Chief Medical Officer, Dr. Jaqueline Bissasor-Mckenzie, also gave an update on the COVID-19 clinical data. Minister of Health and Wellness, Dr. Christopher Tufton, says more than 161,000 first doses of COVID-19 vaccine have been administered so far.
As at Wednesday, June 9th, 2021, 161,850 Jamaicans have received the first dose of the AstraZeneca vaccine. This means approximately 8% of the targeted population, and that targeted population is 1.924 million. So that's 1,924,759. That's approximately 2/3. A breakdown by region shows that of the 161,850 first doses administered, 53% had been in the Sierra region, that's the Kingston, St. Catherine, St. Thomas, St. Andrew region, 18% in the Western region, that would be St. James, Trelawney, Hanover, and Westmoreland. 18% in Southern region, Manchester, St. Elizabeth, and Clarendon, and 11% in Nera, which is St. Anne, Portland, and St. Mary.
Dr. Tufton says a single dose of the vaccine will not ensure immunity from the COVID-19 virus.
You must take the second dose of the AstraZeneca vaccine. If you had another, the Johnson & Johnson, it'd be one dose, the AstraZeneca. And so for persons who have had their first dose and have completed the 8 weeks or so, there's a little room there for, you don't have to be exactly on the 8th week. And so I don't want persons to panic because they may not get it on the exact day. But there is a process to make contact with you through text messaging or calls close to that date, and then you are given some instructions as to where to go to get the vaccine.
The health minister says he's aware there are concerns among some first dose recipients who have not yet received a call to schedule their second dose appointment. He's suggesting that concerned persons return to the center where they received the first dose to inquire about next steps. Meanwhile, Chief Medical Officer in the Health Ministry, Dr. Jaqueline Bissasor-Mckenzie, says the daily COVID-19 positivity rate is now at 2%, but persons 60 years and older continue to be most at risk of death resulting from COVID-19 complications.
3 out of 4 deaths are 60 years and older. 6 out of 10 deaths have cardiovascular disease. 4 out of 10 deaths have diabetes. 1 out of 10 deaths have neurological impairment, and 1 out of 10 deaths have chronic kidney disease.
She says hospital admissions have declined.
In terms of our admissions, our 7-day average for admissions, that also would have peaked in March. And since then, we have been steadily declining in the number of admissions. And over the last couple of days, it has been a little bit up and down, but we don't see any steady increase right now. But we are watching this carefully in terms of the number of cases being admitted to hospitals.
Despite the decline in hospital admissions, the bed occupancy levels are still measured as high level.
Just a reminder that, some persons question whether or not the decrease in our bed occupancy would mean that we would be approaching low level of risk in terms of bed occupancy. But you would see where we would have classified our present status as being at a high level of system pressure in our hospitals because of bed occupancy. And this is because although we have quite a number of beds, up to over 700, that we would have reserved as COVID-19 beds, only about 150 of those beds are really new beds. And so the utilization of beds anywhere above that 150 puts the system under stress, because it is taking up beds and resources that should really be used for general occupancy for other patients, other illnesses that presents to hospital.